I will begin by making sure every student from a family making $85,000 a year or less will be able to go to an in-state 4-year public college or university without paying tuition. And by 2021, families with an income less than $125,000 or less will pay no tuition in a 4-year college or university. Everyone needs to do their part. States will have to step up and invest in higher education, and college and universities will be held accountable for their success of their students and for controlling tuition costs.
Mr. Trump?
You know, I actually agree with Secretary Clinton on a lot of what was just said, specifically that everyone should be able to go out and get an education. However, I do not believe that the proper way to do that is through a handout. The kind of handout of free college that Hillary Clinton is promising. You can do the numbers. I've done the numbers. Many people have. There is no way that we can afford to give out college like candy on Halloween without bankrupting this nation. And that is why I believe that while working with Congress to bring down the cost of college is a vital matter that must be addressed immediately once I am president, I cannot support and will not ever support the handing out of free college to our citizens. Thank you.
Secretary Clinton?
Again, we don't disagree on everything in this category, and I respect his beliefs on college. But as my party and my campaign, one of the top priority is tackling college debt.
Funny that was one of Bernie Sanders' biggest priorities.
Go ahead.
Okay, the quarter of college students who are parents will get the support through my program they need to the resource that they deserve. My plan isn't just about making college free. It's not about making somebody who makes $85,000 or less and leaving out the people who make more. It's about adding more resources. It's about adding more prosperity within these colleges and these students, besides having them get out of college, not finding jobs, and having to tackle the student debt by themselves. I want to replan that completely.
Mr. Trump?
In response to this, I can simply repeat what I've already said. This woman is standing before you promising free college to people making under $85,000 a year. Where does that end? I know families that make $85,000 a year and up, and they're having trouble putting their kids through college too. That's why we need to work, instead of trying to give handouts to our young people, like I said, of the future of America, we need to work on bringing the cost of college down while bringing the quality of education up to make it more competitive on a global scale. And that's what I will do as president, and that's all I have to say.
Secretary Clinton, what are your plans to tackle health issues?
Okay, as we all know, healthcare is a big topic in this debate. Well, an even bigger topic to me is paid maternity leave and family leave, and that is part of my healthcare plan. Today, 8 countries do not guarantee the type of paid family leave at the national level, and the United States is one of those industrialized nations on that list. I want to guarantee 12 weeks of paid family and medical leave to hardworking Americans, and I will work to make sure they receive at least 2/3 of their national wages while on that leave. I will pay for paid leave plan with my tax reform, and that will ensure the wealthiest Americans pay their fair share. My opponent announced a plan for 6 weeks of paid maternity leave for new mothers whose employers do not guarantee pay leave offered through unemployment insurance. However, Donald's plan and my plan differ in many ways. For instance, Donald's plan covers women after childbirth. My plan calls for equal coverage for women and men, whether they become parents through pregnancy, wounded soldiers, or their families. The overwhelming majority of employers have reported that the FMLA has had either a positive effect or employee productiveness. I proposed a national paid leave program and called for guaranteeing paid parental leave for all federal employees. Too many moms have to go back to work just days after their babies are born. Too many dads and too many parents of adopted children don't receive any paid leave at all. Neither do sons or daughters struggling to take care of their aging parents. None of this to families are fair, and that is one big aspect of my healthcare plan.
Mr. Trump?
Hillary Clinton said it herself, I do believe in a 6-week paid maternity leave for mothers. I believe that a mother should be able to spend time with their child and to rest before returning to the workforce. However, this is far from the most important aspect facing the healthcare community and our country at large in regards to this topic. Now, I'm sure you all know I'm very excited for this topic because Obamacare is by far the worst program to have been introduced to our country in the last century. And I'll say it again, in the last 100 years, nothing has hurt our country more than Obamacare. Promises were made to reduce everyone's costs by $2,500. And since the implementation of this plan, we have seen increases of up to $5,000. Almost everyone across the board, no matter how much they're making, is paying more for less health care. And I think that that is disgusting and must be cut out immediately, especially with projections showing premiums rising 70% more if this plan is allowed to continue as Hillary would. Because in fact, when she was First Lady, she proposed almost the exact same plan back in the 90s, as I'm sure many of you may or may not remember. Now, what will I do instead of Obamacare? First off, I will wipe it from the table completely. And I will create a privatized, competitive marketplace that will allow competition to bring down prices while increasing the quality of care. This is a capitalist nation. The idea of capitalism has worked for our business, and now it will work for our healthcare. I believe that buying and selling of insurance should happen across state lines to increase consumer choice while, once again, driving down prices, increasing choice, like I said, and increasing the quality. And obviously, as you know, Hillary Clinton does support Obamacare. She wants, in fact, to expand Obamacare. She
Mr.
wants
Trump,
to
your time
expand
is up.
Obamacare to apply to illegal
Secretary
immigrants, and she wants
Secretary-
to
Mr.
let
Trump?
this terrible
Mr.
plan
Trump.
continue into the future
Mr.
indefinitely.
Trump.
Thank you.
Secretary Clinton.
I do want to expand on Obamacare, and I'll repeat that again. I do want to expand on Obamacare. I want to defend and expand the Affordable Care Act as well, which covers 20 million people.
Those are the same thing, just so
Yeah.
you all are aware.
Mr. Trump. Go ahead, Secretary.
I will stand up to the Republican-led attacks on this landmark law. Obviously, Donald Trump doesn't want it. I want to bring down out-of-pocket costs like co-pays and deductibles, which Obamacare I'm expanding on. I'm not setting forth it completely. I want to reduce the cost of prescription drugs, protect consumers from unsatisfied prescription drug price increases from companies in the market long-standing, life-saving treatments, and face little or no competition. I want to fight for health insurance for the lowest income American in every state by incentivizing states to expand on Medicaid. I also want to expand access to rural Americans who often have difficulty finding quality, affordable health care. I want
Mrs.
to
Clinton.
defend access to reproductive health care and really put the rights to women on the forefront.
Okay, Mr. Trump.
You know what brings down prices of prescription drugs and healthcare? Competition between companies. My plan, which like I already stated is privatized, will increase competition and thereby has been proven time and time again. The one thing that will bring down prices of goods and services while increasing their quality and increasing options is not government meddling, is not the government distributing healthcare to everyone, but it is competition between private companies selling their products on the public field. As for rural communities, like I've just said, I want people to be able to buy healthcare not just in their state, but from any state. This will allow insurance companies to take what they're selling to the people, rather than people having to go long distances simply to purchase insurance and utilize this clearly right that people should have. But people should not have it for free. And I believe that a privatized, competitive marketplace for healthcare is the best way forward for America.
Okay. We are moving now to our last subject, economic policies. Mrs. Clinton, what is your plan to emerge the economy?
I want to do more to support the people who are struggling to balance family life. I've listened to so many of you tell me about the difficult choices you face and stresses that you're under. So let's have paid family leave and earn sick days. Let's be sure we have affordable child care and debt-free college. How are we going to do that? We're going to do it by having the wealthy pay their fair share of taxes and close the corporate loopholes. We have to make the economy fair in order for anything to work. That starts with raising the national minimum wage and also guaranteeing equal pay for women's rights. We can make the boldest investment in good paying jobs since World War II. The measure of our success will be measured in how much incomes rise from hardworking families and how many children are lifted out of poverty, and in not only that, but jobs that provide a sense of dignity and pride. That's the mission that I'm asking all of you to join in with me on. I want to make the top pay their fair share. I want to advance our commitment to research and technology in order to further our industries and jobs for the future. I will establish the U.S. as the clean energy superpower of the world, and I will strengthen American manufacturing and provide tax relief and expand access to capital, small businesses, and that grow, hire, and thrive. I will ensure the jobs of the future in caregiving and services of good paying, recognizing their fundamental contributions to families in America. Rather than focus on any other country's economy, I think it's best we focus on our own for once.
Mr. Trump?